So we have two more components to today's full day of workshop number 2. And as I mentioned before we dispersed, we're going to spend just a little bit of time. The official report backs from your very, very informative sessions. I spent about 15 minutes in each of the work groups, and there were certainly commonalities that I heard in some of the themes across groups, but you did truly do some tremendous deep dives into the questions that you were asked. And again, we will have brief presentations by each of the work group leads tomorrow morning as we get going. But I thought that I would just call each group by number in order and ask anybody in any of the groups to just give a couple of thoughts about what you took away from your discussion. And so I'll start with work group number 1, who asked the question, what are the local, institutional, and national factors driving the initiation of collaborative partnerships between interprofessional education and practice? Anyone from group 1 that would like to reflect on what you heard or what you said? Actually, the bosses right now are out working with the staff to get your thoughts into their PowerPoint for tomorrow morning. So you can't depend upon them anymore. No. Be leaders. You know, big L, little L. Anybody from group 1? Thank you.
Yeah, I'll say something. Well, in group 1, we didn't lack for any dialogue. And I guess I was struck by similarities from across different professions, different countries, and we could contribute when we talked about barriers and challenges and just everything, the institutional, everything Warren was asking us to do.
Okay.
A lot of similarities.
And I think it important as it was a rich discussion. We will only need 2 slides rather than 5, so for all of you, I'm joking. But you gave me enough 10. But the key issue here was thinking about it both with respect to the collaboration of IPE and IPP. In other words, what initiates the connection. We talked, obviously there's a lot of overlap, but that was a key part of our discussion as we moved it through.
Terrific. Anybody else from group 1? Then group 2's question was, what makes collaboration between education and practice for IPE successful and sustainable, and use exemplars to support your conclusion. Group 2?
We also did not lack for robust discussion, and in fact, many debates were held, and we actually have concluded that a few of us are going to collaborate on a series of papers that we think will demonstrate our collective intellectual prowess on this issue. The successes we really felt were driven by assessment and scholarship. The absence of quantifiable, measurable outcomes that demonstrate impact on population health, or our sense of the absence of them, was one that we really felt needed to be driven in order to make sure that the sustainability was a value proposition that demonstrated a return on investment. And we recognize that there will be a diversion of funds, not new funds. But although it's easy to say resources are needed, what we really need to do is to make the business case for a different business case, one that actually gets rid of the notion of business case, but comes back to some of the things we've heard before, which is tackling the ignorance, the economics, and the turf.
Great. Any other group? 2. Yes.
Actually, somewhat to my surprise, Sarita has been relatively moderate in her summary.
Now, Malcolm.
of the discussion. But I think I agree completely with what you said. It was a wonderful thumbnail, and hopefully the slides will reflect that. But there was another element to it, and that is some sense, I think, from a number of people, perhaps not everyone, of frustration with the ongoing debate about this. And we're not here, obviously, to make policy recommendations. We cannot, and we all understand that. But there was a sense of just do some of these things and let's stop talking about it. And I think that permeated a lot of our discussion. And so the issue comes up for the forum as it moves forward is, are there other vehicles, are there other tools that we can use beyond the traditional workshop, publications, etc., both of which are important, to really get something done about this? Because we don't have a lot of time, frankly, to change things. So that sense of frustration, I think, without any real resolution or solution, is something that I think the forum needs to deliberate about. That is, what vehicles are there? Are there big demonstration projects that we can do in a collective sense around interstitial IPE, as opposed to let the thousand flowers bloom kind of IPE? And I don't mean to be derogatory about those experiments either. But I mean, I think we've heard wonderful examples of the flowers blooming, but I think of Faf's comment of, well, what's interstitial about this? I mean, is this the only way we're going to get anywhere? So I think a lot of that sense of frustration. So if we could, in some fashion as we move forward, think creatively about other ways of having an impact or being actionable, I think that would be useful.
So it comes to my mind that a student social media uprising, starting with the 5 young people that we had with us today, might be a step in that right direction. Yeah, and you heard it. You heard it first here. An IPE spring, exactly.
There was talk of manning the barricades,
Yeah.
Jordan.
Yes, Maddie.
Can I just make a brief response to that, which is this, in this room, is collective power in a big way. And we all need to be doing what we can do back where we come from to move this agenda forward in a very actionable way.
And I believe that's why we have, I'm not sure if it's a record number, but it's a substantial number of supporters of this forum, as I think that is the collective driver of divine discontent with the status quo. Group number 3 had the question of how should the outcomes of IPE be measured and assessed, assuming the ultimate goal is better health, higher quality, and improved value. That was the easy question, right, Eric?
Yeah, we're done.
Okay. The tool is in the mail.
Sorry, we were just doing our slides for tomorrow. I think it was a wonderful conversation. No big surprise. Lots of challenges. Some of the common themes we'll spend more time tomorrow talking about. But just currently we don't have easily accessible and fully developed assessment methods and tools. There was lots of good work that was shared, so that's very exciting. But obviously there's not a lot of access to those yet, given that they're often occurring within the institutions. Also trying to rethink the way we approach it. There were some wonderful comments made by several folks that we tend to start at the beginning and then work toward the end instead of maybe we should start at the end and work back, which is certainly an important theme of the Frank Lancet report. Carol talked about entrustable professional activities. And what does it look like in practice? It really works well. And then what type of education would it take to actually get there and then assess against that? And so things like entrustable activities are really helpful. And then obviously, just a lot of challenges getting a workforce up to speed to be able to do this. Not only just do it, but also assess it. And it's going to be a lot of co-learning that's going to be required for that. So those are some common things. I certainly invite anybody else in the room to comment as well.
Assessment. We'll have it all figured out by the morning for sure. And then the last group asked, how does one get buy-in from leadership when initiating or sustaining IPP and IPE? Group 4.
Okay. We spent a lot of time, well spent, in clarifying the question. And we, I think, at least agreed this far, if not the whole way, that we were not talking about ourselves, those of us who would regard ourselves as leaders of IPE. If we understood the question as intended, It was about the manner in which we influence, win over, elicit support from significant others, and we played around with words to describe them in terms of being the key holders was a good one that was used, the movers and the shakers, the people who are, and I think we come back to Matty's point just now about those who occupy power, some of them are here, the people who are actually in the position, if they are persuaded, to win over highly significant organizations in each of our countries and indeed at the international level. So I think we made a lot of headway with the question. The conversation absolutely flowed from then on, Melissa. And when we got to the end and Melissa was asked to give her feedback, it was phenomenal. I do think, in fairness to her, you should give her till Monday to put together her article for the Journal of Interprofessional Care. And hopefully Scott Reeves is over his flu and we'll be ready to receive it. But there was a vast amount of material that neither now nor in the morning can be adequately reflected back, but does, I think, bear mightily on your agenda in terms of next steps. So that's really where we were. In terms of trying to summarize that, we talked about involving people at different levels to confuse the picture, I think, in terms of concentric circles, those on whom we depended for support most immediately, our deans, our provosts, people in our own institutions, those in the world of practice, and beyond that, the support of the whole range of professional employment, regulatory, commissioning, funding, bodies, etc., etc. And if one thing was clear, it was that you can't generalize about how you make your approaches. A lot of this is highly individualized. I did, as facilitators, suggest that this was painting a very clear picture of the kind of leadership skills which we need to confuse the message as the people from within, trying to present IPE to win the support from these significant others. So how we got the message across, at one sense, was highly individualized, and no one of us could answer for which dean had which hang-ups in which institutions. But I did, and I think we went this way, begin to steer the discussion in a more general sense, that those of us who work for organizations in the background have some obligation, have I pinched your chair? Some obligation in terms of the written word, the basic documentation that explains IPE. And if I may be allowed one personal preoccupation, I'm immensely impressed by the way in which the IPE literature enables us to speak to each other, noticeably the Journal of Interprofessional Care, since I handed it over. We're not so good at explaining ourselves to these significant others. And I think one of the things I would hope we can look at further is how we put the basic messages together that help each of us, as in the group who are at the front line, in talking person to person to win them over.
Very nice. Any other thoughts from group 4? Lest anybody thinks they need to lose sleep over losing any of the richness that can't get translated into 5 slides by 8 o'clock tomorrow morning. It all gets captured, of course, and will be integrated into the deliverable from these first 2 workshops, which the Planning Committee and staff have talked about being blended, of course, into one common document because of the interlocking nature of the materials that have been covered and presented. So it'll all be available, which is great. Well, I think the reason why Sarita was so concise in her words was because I get to call upon you next. Yeah, okay, no, don't stop tweeting. No, tell them how wonderful you're going to be, and then they'll get onto the webcast.